Hello, I'm Dr. Mahootchi from the Eye Clinic of Florida in Zephyr Hills, Florida. The following presentation is about the laser treatment of narrow angles, a common condition that can lead to permanent vision loss if not treated early and properly. Narrow angle refers to a condition in the eye where the angle, which is where the iris and the cornea meet, is a part of the eye where the fluid is drained, is relatively blocked and fluid can't get out of the eye, leading to high pressures in the eye, which can damage the eye. Most of the time, you can look at an eye and tell way before somebody has angle closure whether they're at risk for this condition or not. So it's important to recognize it early and treat it early. Unfortunately, there's been a disturbing trend in the Tampa Bay area in Florida where HMOs have been denying patients proper early treatment of this condition that can prevent vision loss and damage to eye structures. So the purpose of this video is to educate providers and patients about the condition and why we treat it. The fluid in the eye is produced behind the iris in a part of the body called the ciliary, or the part of the eye called the ciliary body. Fluid usually travels behind the iris and through the pupil, kind of in the opposite way that light goes in the eye, and then out into the drainage mechanism or the angle. This is a gonioscopic or a special kind of lens that we use to look at the eye, and you can see the iris as a plane that kind of leads up to this darkly pigmented line, and that's the angle. That's where fluid is drained from the eye. In narrow angle, the part of that angle is narrow, and it's that way because fluid builds up behind the iris because it can't get out through the pupil because either the eye is very small and things are cramped in there, or the patient has a very large cataract relative to the size of the front of the eye and fluid just can't get around. Here, the fluid then builds in the back of the iris and pushes the irid forward, creating a condition called angle closure. Angle closure is when someone with narrow angles finally has their angle closed and the pressure can shoot up very high. When this happens, the eye can hurt, damage can be done to the inside of the eye, sometimes permanently, and damage can be done to the vision, often permanently. It's important that these people get treatment early, and because once the angle is closed, the time is against you. So going to the emergency room, where all sorts of different providers can be confused by why is the eye painful and red, can frequently be avoided by getting early eye exams and determining whether the angle is narrow in the first place. If it is, the treatment can be performed on a non-emergent basis with little loss of time and little risk to the eye, thus preventing vision loss and damage to the eye. The treatment's actually been around for many decades. Back in the 30s, 40s, and 50s, people went to the operating room and the eye was numbed, and a small section of the peripheral iris was removed surgically. That's rarely done today. Now lasers can be used without cutting the eye to make a small opening or hole into the peripheral iris so that fluid is no longer trapped behind the iris and can move forward and out of the eye through the drainage mechanism or the angle. And here shows a picture of fluid moving through the iris and pointing toward the angle where it'll drain out of the eye. Fluid that's made in the eye drains into the bloodstream and not into the tear film, which is a common question that patients often ask me. This is a picture of someone who's had a peripheral iridectomy surgically. The opening doesn't open again into the outside world, but you can see through the iris, through the cornea here. This has been part one of my presentation. In part two, you'll actually see some videos of me, Dr. Mahootchi, performing some laser peripheral iridotomies at our surgical center, same-day surgery center in Zephyr Hills, Florida. Thanks for your attention.